Good afternoon, class. Today we want to do abdominal examination. So we're doing abdominal examination for a pregnant woman who is about 36 weeks. So she's 36 weeks and she has come for antenatal. Okay, we just need to do the examination of the abdomen. So I want to see how the baby is lying, or the position, presentation of the baby, and all that. So that's what we want to just check. So before we start, as usual, we have to wash hands. So then you dry. So good morning, Mrs. Mulenga. I am student number 2. I've come to do abdominal examination on you. May I please go ahead? Okay. Is there anything I can do for you before I begin? Okay, nothing. So let me just start. So before you start touching her, you have to warm your hands. But then as you are warming, you have to start with inspection. So you need to ask Mrs. Mulenga to expose you so that we do inspection. So you expose the abdomen. So as you expose the abdomen, then you warm your hands. So on inspection, what you're going to do is to look at the abdomen. Is it corresponding with the gestational age? So at this moment, if it's corresponding, you're going to tell the examiner to say that the abdomen is corresponding to the gestational age. So that's the first thing. Then another thing on inspection, so you tell the examiner, I can see the linea nigra is present, stria gravidarum is present. So stria gravidarum is just the stretch marks. If they are present, you say stria gravidarum is present. Then another issue that you look out for are scars. So at this moment, Mrs. Mulenga doesn't have any scars. So you're going to talk about the shape of the abdomen, if it's corresponding to with the gestational age. Secondly, stria gravidarum. Thirdly, linea nigra. Fourth, you talk about the scars. So that's under inspection. So you can do that. So then after that, you need to measure the height of fundus. So you're going to get the measuring tape, and then since it's 36 weeks, you're going to obviously identify, okay, this side it's centimeters, this side it's in inches. So you're going to use the side which is in inches. So for you to find out where 36 weeks is, you have to go where the umbilicus is. So the umbilicus, or the umbilical cord, the umbilicus is here. So then when it's here, you need to at least count with your finger, using finger breaks. So if you know how to count, you can even say, okay, if this is 22, just above the umbilicus, so you just have to go through that. So you have to now go 22. So this will give us 22, 23, 24, 25, 26. So we can do that, 26, 27, 28, 29, 30. Then this one will give us 32, 34, then 36 will be somewhere there. So since you even know that 36 will be somewhere there, so you can get the tape and go to the upper border of the symphysis pubis. Okay, so symphysis pubis there, that's the upper border. So you put the tape there so that you and then you put it where the inches are, so that you are not biased with the measurement. If you put it on centimeters, you'll be biased, but put it where the inches are, then hold it that way. Then since you know that 36 weeks can be somewhere here, okay, so that's why you go. So you tell the examiner that 36 weeks is here because this is where I can feel the resistance. So the resistance which you're able to feel is that resistance of the uterus and which is forming the placenta there. So that's the resistance you're able to feel. So you tell the examiner, okay, the resistance is here. This is why I'm able to feel the resistance. So the uterus is forming something there. So you'll be able to feel the uterus, and then obviously you'll be able to feel the resistance. Okay, so this is what 36 weeks is. So you can even tell and check. So here it has given me 35 centimeters. So meaning that 35 centimeters converted to weeks to give us 36 or 35, sorry. So you'd even say that at least it's close to 36. They're not far away. So after that, you need to find out now about the baby. How is the baby now positioned there? So you need to start now the palpation. So when you palpate, you start with this part. So you do this part, we're going to call it fundal part. So we're going to do fundal palpation. So under fundal palpation, you hold like that, then you feel. So at 36 weeks, mostly the baby's turn. The buttocks will be here, and then this week and this time of the weeks we would say the back is here, or it can be there, the back can be there. But then in this case, since it's for exam purposes, we assume that the buttocks are here, the back is here, the head is there. So let's say if the buttocks are here, then we do fundal palpation. So I'm doing fundal palpation. Then under fundal palpation, you'll be able to feel at least a round soft mass. So when you feel round soft mass, you'll be able to say that these are the buttocks of the baby. So round soft mass denotes the buttocks of the baby. So that's under fundal palpation. Then don't let go. Go to lateral palpation. So lateral palpation, you want to palpate the furthest. So you push this side, you go this way, then you push the uterus or the abdomen this side so that you palpate this part. So when you do that, you start from lower part here. You do that. So what I'm able to feel this part as I do this, because this is the linea nigra, so you do only this part. So what I'm able to feel is a continuous smooth mass. Continuous smooth mass denotes that the back is here. That's why it's continuous and smooth. So this is the back. So it denotes that the back of the baby is this side. So when I push this side to examine the nearest part, the lateral, under lateral palpation, again I start. So if the back is here, definitely you feel here irregular masses. When you feel irregular masses as you are palpating like this would denote that these are the fetal limbs. So it will denote that the fetal limbs are here, then the back is here. So the back is continuous, smooth mass, then the limbs are irregular because one will be here, there, there, there. So that's why they are called irregular masses. Then you go to the pelvic palpation, just switch. Under pelvic palpation, you palpate like this. So when you palpate, you feel a round hard mass. So when you feel a round hard mass, you're going to say that here on the under pelvic palpation, the head is here because you are going to say that this is a round hard mass. So round hard mass denotes the head of the baby. Then you need to ballot it. You need to shake like this. When you shake and it's able to move, meaning that the head is not engaged. So it's ballotable. So I'm going to say that it's ballotable and it's not engaged. So this is what you do. So at this moment, you are done with palpation. You have to go to auscultation. So you need to get the fetal heart rate. So since the back is here, what you're going to do is you're going to demarcate. This is where the buttocks are, the head is this side, and then the heart is closer to the head. So you need to go to the lower part. So you need to divide in the middle. So this part you divide on the umbilicus, and then this side on the umbilicus. So this lower part, this is where the back is, and this is where the heart can be felt. So you need to put this there, the penile stethoscope or fetoscope. Then once you do that, then you're supposed to feel for the mother's pulse, okay? So you feel for the mother's pulse there, then you compare with the baby's. So when you able to get it, then since this is a dummy, you're able to count there in a minute. You'll be able to say that fetal heart is regular. So fetal heart rate is regular because you haven't counted as in counting on a real patient, you're using a dummy. So just give us to say that you're able to hear it and comparing with the mothers, so it's regular. So that's what you do. Then in terms of documentation, you're going to say that giving handover to the in-charge to say that, okay, on my examination, my in-charge, the fetal head is not engaged and the descent is 5/5. Why it's 5/5? Because you had to ballot and then it's not engaged. So tell, okay, it's ballotable and 5/5. Then what about now the presentation? So when you say presentation here, presentation, I'm going to say it's vertex because this is oxalocephalic because this is just the head which is there. So it's this side here. Then what about the lie? Okay, so the lie, the child is in this manner, lying in this way. So the lie is longitudinal. So tell the examiner, okay, the lie is longitudinal because it's lying that way. Then what about, say, the position? The position you just have to follow. This is the left hand. So it will be, this is the left. So left occipital anterior. So this, because this is the left hand of the mother. So, and that's where the back is. So you're going to say, okay, this is the back, this is the left arm of the mother. So you'd be like left occipital anterior. So that's the line. And then height of fundus, which was there, you found out that it was 35. Okay, 35 weeks. So at this moment, you are done. So you can even thank the mother, okay, and tell the mother to lie in left lateral. So the mother can be assisted to go in left lateral, okay. So you can go there and assist. Then try to, after you put the mother in left lateral, then give the mother IEC, so that the mother should continue coming for antenatal, so that you keep checking, okay. And after that, try to also tell the mother about be able to feel if the child is moving or if the baby is moving in the uterus, so that they know, because sometimes you may find that the baby is not moving, so the mother has to be aware of such. So the in charge has to be told as well what you have done and what you have documented. Then thereafter, you need to go and wash hands. Okay, so after you do that, you're going to at least dry your hands, and then you're done the procedure. So the first thing you started with was inspection. So you inspected about 4 things, which you did. After that, you did your palpation. So under inspection, that was linea nigra, stria gravidarum, the scars, and also the size, or the size is corresponding with the gestational age. That's what you did, 4 things. Then under inspection, that's all. Then under palpation, you did fundal palpation, where in this case the buttocks were here. Then you did lateral palpation, where you found the back is here, which is a continuous smooth mass. Here it was a soft round mass, meaning the buttocks. Continuous smooth mass, the back. Then here under lateral palpation again, you found that it was irregular masses. So those were denoting the limbs of the baby. Then under pelvic palpation, you found that it was the head of the fetus and it was hard round mass. So that's what you did. Lastly, you had to demarcate from the umbilicus like this, from this side, and then linea nigra like that. Then you had to go there on the outer part, lower portion, to get the heart rate of the baby. So that's what you did. So simply those things, meaning that you're going to do abdominal examination. So thank you very much for watching, and keep practicing this procedure. It's a long procedure.